A body is found at midnight on the outskirts of Dhaka. No witness, no weapon, no confession. The police are completely in the dark. But one person walks in, calm, gloved, and trained, a forensic physician. Within hours, they determine the exact time of death, identify the type of weapon used, and discover traces of poison that nobody suspected. That single medical report changes everything, and a murderer is brought to justice. This is not a movie scene. This happens in real life. And this is exactly what forensic medicine does. Welcome to Forensic Alliance of Bangladesh. If you're an MBBS student who wants to master forensic medicine, not just for exams, but to actually understand how doctors solve crimes, you are in the right place. Stay till the end because we'll also cover the key exam points you absolutely cannot miss. So let's begin with the basics. Forensic medicine, also known as legal medicine or medical jurisprudence, is the branch of medicine that applies medical knowledge to assist the legal system, especially in criminal and civil cases. The word forensic comes from the Latin forensis, meaning of the forum, the ancient Roman court of law. In simple terms, wherever law and medicine meet, that's forensic medicine. As a forensic physician, your job is not to find the criminal. That's the job of the police. Your job is to find and interpret medical evidence that helps the court understand what happened to the human body, when it happened, how it happened, and sometimes who did it. Forensic medicine sits at a very powerful crossroads. And as an MBBS student, understanding this subject means understanding how your medical skills can directly serve justice. Now, forensic medicine is not just one thing. It has several important branches and each plays a specific role in crime investigation. 1. Forensic pathology. This is the heart of forensic medicine. Forensic pathologists perform autopsies to determine the cause and manner of death. They examine bodies from homicides, suicides, accidents, and suspicious deaths. 2. Forensic toxicology. This branch deals with poisons, drugs, and alcohol. When someone is suspected of being poisoned, the toxicologist analyzes blood, urine, and tissue samples. 3. Clinical forensic medicine. This involves examining living patients, victims of assault, sexual violence, road traffic accidents, or torture, and preparing medical legal reports. 4. Forensic serology and DNA analysis. Identifying individuals through biological samples like blood, saliva, or semen found at crime scenes. 5. Forensic odontology. Using dental records and bite marks to identify victims or suspects. 6. Medical jurisprudence. This is the legal side, covering the rights and duties of doctors, consent laws, professional negligence, and how doctors testify in court. Each of these areas has direct application in real criminal cases. Let's now see how a forensic doctor actually works at a crime scene. When a suspicious death is reported, the forensic physician may be called to the scene, and their role begins even before reaching the mortuary. At the crime scene, the forensic doctor will, first, observe the body in situ, meaning in its original position, without touching anything unnecessarily. The position of the body, lividity, and rigor mortis all give vital information. Second, estimate the time since death, or TSD. This is done by checking body temperature, algor mortis, stiffness of muscles, rigor mortis, distribution of lividity, the bluish-purple discoloration of skin from blood pooling, livor mortis, and early decomposition signs. Third, they note any injuries, blood patterns, or signs of a struggle. Fourth, they communicate findings to the investigating officer and preserve evidence, because in forensics, contaminating a crime scene can destroy a case entirely. Remember this key point for your exams. The forensic physician does not investigate the crime. They investigate the body and provide objective medical evidence. The autopsy, or post-mortem examination, is perhaps the most powerful tool in forensic medicine. There are two types you must know. 1. Medico-legal autopsy, performed at the request of legal authorities in cases of suspicious, sudden, unnatural, or violent death. And clinical autopsy, performed with consent to understand disease, not relevant to crime, but important for your broader knowledge. In a medico-legal autopsy, the forensic pathologist follows a systematic process. External examination first. Clothing, injuries, identifying marks, state of nutrition, rigor mortis, lividity. Then internal examination. The body cavities are opened. The brain, lungs, heart, liver, kidneys, and other organs are examined individually. Each organ's weight, color, texture, and pathology are documented. Samples are collected: blood, urine, stomach contents, vitreous humor from the eye, all for toxicological and histological analysis. The final product is the post-mortem report, an official medico-legal document that answers what was the cause of death. Was it natural, accidental, homicide, or suicide? This report can make or break a criminal case in court. One of the most important skills a forensic physician has is the ability to analyze injuries and wounds. Let's look at the most common wound types in criminal cases. Incised wounds, clean, sharp edges, caused by sharp-edged weapons like knives or blades. The length is greater than the depth. Stab wounds are caused by pointed weapons. The depth is greater than the length. The shape of the wound can tell us about the weapon used. Lacerated wounds, irregular, torn edges, caused by blunt force, commonly seen in assaults with rods, stones, or fists. Gunshot wounds have entry and exit characteristics. Entry wounds are typically smaller with abraded collars. Exit wounds are larger and more irregular. The distance of firing, presence of blackening, tattooing, and singeing of hair all help estimate the range. Defense wounds are cuts or bruises on the forearms and palms, suggesting the victim tried to protect themselves. These are extremely significant in homicide cases. Each wound type tells a story. Your job as a forensic physician is to read that story accurately, because in court, your opinion carries enormous weight. Estimating time since death, or TSD, is one of the most tested topics in your forensic medicine exams, and one of the most practically important skills. Let's go through the key markers. Rigor mortis. After death, the body cools towards ambient temperature at roughly 1 degree Celsius per hour under average conditions, though this varies significantly with environment, clothing, and body size. Rigor mortis, muscles begin to stiffen due to ATP depletion, appears 2 to 6 hours after death, complete 12 hours, begins to pass 24 to 36 hours, and completely gone 48 to 60 hours. Livor mortis, blood pools in dependent areas, appears 30 minutes to 2 hours, fixed after 6 to 12 hours. This is critical. If lividity doesn't match the position of the body was moved after death. Decomposition, bloating, skin slippage, and discoloration begin after 48 to 72 hours in tropical conditions like Bangladesh, where heat accelerates decomposition significantly. Entomology. In advanced decomposition, insect activity, particularly blowfly larvae stages, can estimate death to within days or even weeks. Knowing these timelines is not just exam knowledge, it's what allows an investigator to construct an accurate timeline of a crime. Modern forensic medicine has expanded beyond the autopsy table. Today, science gives us incredibly powerful tools. DNA analysis. Every human being has a unique genetic code. Biological material left at a crime scene, blood, hair follicles, saliva, or semen, can be analyzed to identify individuals with near-perfect certainty. In Bangladesh, DNA forensics is increasingly being used in rape cases, unidentified body identification, and paternity disputes in legal proceedings. Forensic toxicology, when poisoning is suspected, samples from the stomach, liver, kidney, and blood are sent for chemical analysis. Common poisons encountered in South Asia include organophosphate compounds, arsenic, cyanide, and pharmaceutical overdoses. The toxicology report can confirm whether the person was drugged before the crime. Histopathology. Microscopic examination of tissue can reveal vital reaction, meaning cellular changes that show the injury was sustained while the person was still alive. This can differentiate ante-mortem from post-mortem injuries, which is hugely significant in homicide cases. Forensic radiology, X-rays, and CT scans can reveal old injuries, bullet fragments, or skeletal trauma that's invisible externally. As a future doctor, knowing when to request these investigations and how to interpret them makes you an invaluable part of the justice system. The forensic physician's work doesn't end in the mortuary or the clinic. It continues often months or years later in the courtroom. The medical-legal report, or MLR, is a formal document prepared by the doctor that records identity of the deceased or patient, clinical or post-mortem findings, nature and age of injuries, cause of death, immediate, underlying, contributory,